An electrocardiogram, abbreviated as EKG or ECG, is a test that measures the electrical activity of the heartbeat. With each beat, an electrical impulse, or wave, travels through the heart. This wave causes the muscle to squeeze and pump the blood from the heart. A heartbeat on an EKG will show the timing of the upper and lower chambers. An EKG can detect and monitor an array of health conditions, from arrhythmias to coronary heart disease to electrolyte imbalance. As of today, the 12-lead EKG remains the standard diagnostic tool. Its main purpose is to screen patients for possible cardiac ischemia. It will assist in quickly identifying patients who have had an ST elevation myocardial infarction, or STEMI, or a heart attack, and perform appropriate medical interventions based on those initial readings. The 12-lead EKG paints a picture of the heart's electrical activity by recording information through 12 different perspectives. You think of it as 12 different points of view of the same event that's woven together to tell a cohesive story, known as the EKG interpretation. These 12 views are collected by placing 10 electrodes on the patient's chest, arms, and legs. These electrodes are connected to a machine that registers the heart's activity. To measure the heart's electrical activity accurately, proper electrode placement is crucial. When it comes to patient positioning for the 12-lead EKG, you need to 1. Ensure that all electronic devices and metal objects are removed from the patient. 2. Place the patient in a supine or semi-Fowler's position. If you're unable to place the patient in either one of these positions, you can perform the EKG with the patient in a more elevated position. 3. Have the patient lay flat with their arms by their sides and ask the patient to relax their shoulders and keep their legs uncrossed. 4. For patients that do not fit comfortably on the bed or exam table due to size, ask them to cross their arms over their stomach to reduce muscle tension and movement. 5. Ask the patient to lie still and quietly until the test is done. Tips for skin preparation. 1. Skin should be dry, hairless, and oil-free. Shave hair that can possibly impede electrode placement. Electrodes should have full contact with the skin. 2. For better electrode adhesion and oil-free skin, rub the area with an alcohol prep pad or gauze pad with benzoin tincture. 3. Promote an environment that prevents the patient from sweating profusely. Now that the patient has been properly prepared for the EKG, let us take a look at the chest electrodes and their placement. The V1 electrode should be placed on the 4th intercostal space to the right of the sternum, near the level of the armpit crease. The V2 electrode should be placed on the 4th intercostal space to the left of the sternum, near the same level of the armpit crease. The V4 electrode should be placed on the 5th intercostal space at the mid-clavicular line. However, please note that for female patients, V3 through V6 should be placed under the left breast. Do not use nipples as a reference point when placing electrodes for either men or women, because nipple locations vary from person to person. The V3 electrode should be placed midway between the location of V2 and V4. The V5 electrode should be placed on the anterior axillary line on the same horizontal level as V4. The V6 electrode should be placed on the mid-axillary line on the same horizontal level as V4 and V5. Now let's look at the limb electrodes and their placements. The RA, or right arm electrode, can be placed anywhere between the right shoulder and right elbow. The RL, or right leg, can be placed anywhere below the right torso above the right ankle. The LA, or left arm electrode, can be placed anywhere between the left shoulder and left elbow. The LL, or left leg electrode, can be placed anywhere below the left torso and above the left ankle. Please note that limb lead placements should be uniform, but can vary, especially when encountering amputees. For patients with a below-the-knee or partial leg amputation, the RL and LL electrodes can be placed on the bilateral thighs. For patients with a complete leg amputation, the RL and LL electrodes can be placed on the bilateral lower abdomen. For For patients with an arm amputation, the RA and LA electrodes can be placed on the bilateral shoulders. Exact placement of each electrode on the patient is important. Incorrect placement can lead to a false or misleading diagnosis, so make sure the electrode conducting gel is fresh and adequately moist. A dry electrode with inadequate gel reduces the conduction of the EKG signal. Oftentimes, electrode gel dries out as a result of incorrect storage. Store electrodes as instructed by the manufacturer and do not remove them from their pouch until they're ready to use. Do not place electrodes on skin directly over bones, incisions, irritated skin, and body parts where there are lots of possible muscle movement. Use electrodes of the same brand. Using different brands with dissimilar composition can hinder an accurate EKG trace.